Good evening, everyone. Thank you all for joining us here today. Welcome to the live PCOS webinar organized by MedMap Medical Services. We have been constantly working on this disease PCOS to create awareness among public. And today we are launching our live PCOS webinar. So, the reason why we took up this particular disease PCOS is that because of the alarming strategy of this disease itself, because the prevalence of PCOS is increasing day by day. And also, many of the women go undiagnosed without knowing that they are actually having PCOS. So we are particularly focusing on to create a awareness among public in this regard of PCOS and also to remove the misconception that is existing in this particular disease. So moving on to the webinar. Before moving on to the webinar, I would like to introduce at another 7-day interactive program for the person who was affected with PCOS. That is, at the commencement itself, as I addressed, the particular aim of this program is to create awareness among public in this regard of PCOS and to give support to the women who is affected with PCOS. So we are introducing a 7-day interactive program for supporting to the women with PCOS. So as we all know, the PCOS is a lifestyle disorder and it can be managed only by lifestyle modification. The pharmacotherapy, that's the medicine, always take the second seat. So this particular program is intended to give support by modifying the lifestyle changes. Without any medication, it will be led by a team of qualified doctors from our team. And this program is designed to empower individuals with PCOS by providing them with essential tools and knowledge and to effectively manage their symptoms, particularly through lifestyle changes only. And each day, each day of the 7-day will be focusing on a specific theme, combining education with interactive activities to encourage engagement and also to create self-awareness. And the objectives of this program is to increase the awareness. I'm repeating the sentence. It is particularly to create the awareness among the public and understanding of PCOS and its effects on health. That is, PCOS is having numerous risk factors that will be dealt in this webinar. And to equip the participants, the role of diet and nutrition and also the exercise strategies that can be adopted in PCOS, and to promote the self-care and stress management techniques. That is, PCOS is a condition having poor physical and mental health. So mental health has to be emphasized. So stress management techniques will be developed, will be discussed, and also to generate a supportive community among these individuals with PCOS. So the plan will be like this. The day 1, there will be an exclusive interactive discussion and also an awareness session will be there regarding the PCOS symptoms, the management, the risk factors, everything. And the importance of diet and the exercise will be discussed. And also the meditation techniques will be discussed to the participants. And there will be a question and answer session also. And for the day 2, there will be a task. The day 2 will be based on another theme, and there will be a task will be given, and there will be goals set for daily activities, and there will be interaction in the community and the meditation and the daily updates will be there. So the day 3 will be particularly on the nutrition. That's the nutrition is really very important. So the role of nutrition and how to prepare an ideal meal for the PCOS patient and the PCOS disease and the person-friendly diet recipes all. And also the PCOS power foods. That is, what are the PCOS power foods that we can give. That will be discussed in the 3rd day. And also the task. The 4th day, there will be another task based on the another theme and the set goals for the daily activities. And the interaction in community will be there. and the meditation techniques, daily updates and challenges will be dealt in the day 4. And the day 5, there will be self-awareness task will be given for the goal tracking. There will be other goals for the daily activities, and the interaction will be there, and the meditation, daily updates and challenges. And in day 6, the yoga, it is very important for managing the physical and the mental health, the particular yoga poses for the PCOS, and also the breathing exercises, the meditation techniques, and the challenges that facing during the daily updates. And day 7, it is the final day, and here there will be interactive discussion and the progress that you have taken from the day 1 to the day 7, and the challenges faced, the milestones, and the question and answer session will be there. So this is the day 7 plan. So the details regarding this will be announced at last. So please stay tuned. And today we have for the PCOS webinar, Dr. Divya Srinath, doctor from our side. Welcome to the session, doctor. Dr. Divya Srinath is the specialist consultant of Dr. Divya Ayurveda Gynecology and Infertility Center. And doctor is joining our team for leading the PCOS program. And doctor is having experience in this field for more than 10 years regarding the infertility and also the treating cases of PCOS. Not only in India, abroad also doctor is having patient. So we are extremely happy to have doctor to joining this particular webinar and also this PCOS program. And very happy to have you here, doctor. Welcome to the session and handing off the session to you. Hello, doctor. Hello. Doctor, your voice is not clear. Hello. Hello, doctor. Hello. Doctor, voice, can you speak little bit louder? The voice is very feeble, not able to follow that. Now it's not audible at all, doctor. Hello, doctor. I request participants to wait for a couple of minutes. There is some technical glitches regarding the audio on the faculty side. So please stay for a couple of minutes. We will correct the issue immediately.
Hello, Doctor Minu. Am I audible?
Yes, doctor. Now it's clear.
Okay.
Okay.
Thank you. Thank you all for your patience. Can one or two switch on the video so that the session will be more interactive? So, myself, Dr. Divya Srina. So, today's session, as we had discussed, thank you, Vaishali, is regarding PCOS or PCOD. So, we heard the term like it's more familiar PCOS, PCOD. Is both the same, or can we reverse the PCOS or PCOD, or it's a life or it's a lifelong thing which we need to suffer? So let's check it out. So we all know about the normal menstrual cycle, right? So it's a cyclic procedure which occurs in 27 to 31. It's considered as normal. And usually bleeding will last from like 5 to 7 days without any chunks of blood. Like the bleeding is usually normal without any heavy clots. But with the membrane, we can see that's quite normal. That is from the inner lining of the uterus. Okay, so here you can see the very beautiful uterus. So the here it is. I'll share. So here you the inner lining of the uterus, the fallopian tube, two beautiful ovaries, the lower portion of uterus, then the vaginal canal. So every month, the inner lining of the uterus, inner lining especially, I hope you can see. So the inner lining, this the particularly marked as that is the endometrium, which is shed down during each menstrual cycle. So for shedding that down, for minimum of 8 millimeter of thickness, endometrium should develop. For that, the ovaries plays a major role. Okay, the normally the eggs or the follicle that is known as eggs, which is developed during each cycle. So up to around like 14 days, an egg will pop out. So this whole procedure indirectly support the development of the inner lining of the uterus. That is the normal menstrual cycle which we experience. So usually, if there is proper hormone support is there, the properly there will be normal bleeding will be there without any chunks and like that. So there are so many factors which indirectly depend our menstrual cycle, like our stress. Usually we can notice like when during our exam times in schools and college, we experience some delay in periods, like 4 or 5 days delay in periods. That is because of stress that we face during our exam time. So the brain is having a major role, then the ovary plays a major role, the liver, the pancreas, all are having control over the ovarian function. So that determine our menstrual cycle. Menstrual cycle, menstruation is the visible manifestation which we feel like, yeah, this month I got periods. Last month I missed my periods. So what is happening inside? There is some imbalance in the functions of ovary. Some inner support is not properly get from the brain, like especially the FSH, LH hormones. That's a beautiful hormone which plays a major role in a normal menstrual cycle. So usually menstruation occurs, we know, from day 10 years to 16 years. So my mother all got menarche by 16 years, and I got my first menarche during the 13 or 40, 13 and a half, 14 years. My daughter got it at 12 years. So there is some change gradually, like menarche is occurring earlier. I got a patient who attained menarche at 9 years, 8 years, like that. So all these things depend upon our nutritional factor, our genetic factor. So that is very important. Like now we are taking like more nutrient rich food, high calorie food. We follow so many bloggers, YouTubers, and we just try new foods. And that my like more KFC, more chicken, more cheesy foods. All these things are high calorie, which which cause more deposit of fat and all that indirectly affect the normal cycle or that trigger early menarche also. Can you imagine? While attaining menarche itself, some girls are affected with PCOS. Yes, you heard it right. Like from like age 12 years, 11 years, girls are having PCOS during the time of menarche itself. So it is not purely our diet or lifestyle. Our genetics or our genes or which are coded in our DNA plays a major role. Suppose a lady, say about Sharanya. So she was having PCOS and she faced some difficulty in getting pregnant. So either with treatment or IUI or IVF, she can't see. So during the pregnancy time itself, like if she switch on to like unhealthy diet, lifestyle, and all these factors may indirectly trigger the development or indirectly support the development of PCOS in her child also. If she's a girl child, she's having a high risk of developing PCOD in her later life. And also we can notice that PCOS mother are having higher chance of developing diabetes during the pregnancy time. That's more common. They are prone for this insulin resistance or that I will explain detailing later. Okay. So again, this lady continued on the diet and lifestyle like it's a precious, maybe a precious child. So we will give more chocolates, more sweets, whatever things she asks. Now switch on TV and sit in front of it, sedentary lifestyle, no activities. Again, this cycle comes into action. So we can prevent the further like transmission of PCOS to a next generation also. We can try to prevent also. Okay. So genetics plays a major role. Our genes plays a major role. We can also see some of our friends who are more obese than us or more like obese, but they are having regular periods. Sometimes we wonder why they are more obese than us, than they are having regular cycles. Why it's happening? It's because genetics or genes play a major role in insulin resistance, acanthosis that we'll discuss detailedly later. So usually patients with PCOS come to our clinic or come to or go to any doctor complaining of either irregular periods. Doctor, periods is not happening this month. Periods came 4 months earlier, 2 months earlier, 3 months earlier, like that. Or facial hair growth or neck pigmentation, mood swings, like that. These are the common presentation that the patient will tell, or sometimes the patient will come for the fertility treatment. Then only they will diagnose that they are having mild to moderate PCOS or sudden weight gain, or the lady may find difficulty in losing weight. So these are the major concerns that commonly women are facing with PCOS. So we usually wonder whether weight gain trigger PCOS or PCOS cause weight gain. It can happen both ways. So PCOS, or the lady who's having a tendency to develop PCOS, switch on to more like high calorie lifestyle changes and all, that will increase the weight gain and that will indirectly trigger PCOS. Or even some lean PCOS patient, again, they are having high risk of developing obesity also as a part of PCOS progression. And the weight loss is one of the main treatment for PCOS, or lifestyle modification. But during the course of PCOS management, we will find some difficulty to lose weight, but we had to be consistent in managing PCOS. We had to be patient, stick on to the plan, be consistent. That is the one thing how we can beat PCOS. So menstrual irregularities, like usually some patients will have 1 or 2 periods in a year, or some periods occurs in 32 days, 35 days, 60 days, or with some medication only they will get periods. Or during the periods, we may have some spotting only, sometimes heavy bleeding after 2 months or 3 months. So it varies from different patient to different. The clinical presentations are different in different patients. And mainly the mood swings around the periods, they are facing so many mood swings, ups and down. Like they will cry, cravings for more sugar, they will feel like emptiness, all these things, especially the family members are noting this PMS, premenstrual symptoms than the lady. And after get attaining periods or after getting periods, suddenly her mood changes. And she may sometimes wonder why I behaved like that. That is something that some patients will tell. So when attaining uh, periods or during the periods, the lady may have severe pain during periods or sometimes like severe cramping, or some patients may even tell they feel ovulatory pain, like severe ovulatory, like pricking type of pain, especially on either sides of the abdomen, sides of the lower abdomen around ovulation time and all. That is also because of the thickened ovarian cortex and all, that will trigger, that will cause the pain. The lady may feel more pain. So PMS, like especially around or like 5 to 7 days before periods, the ladies may feel severe bloating. It varies from patient to patient. Like some may have severe bloating, gas formation, some may have loose stools, breast pain, breast heaviness, like mood swings, more craving for sugar, and like mood irritability, anger, sorrow, mixed feelings. That is part of this imbalance in the hormones which is caused by the PCOS. So some may also have severe headache or migraine may trigger prior to periods, or more pimples may pop up around the time of periods. And so one major thing which we notice in most of the PCOS subjects are the stress during work, stress in family. Like even housewife ladies, they also feel stress. Like what to cook for the dinner, what to cook for the lunch, how to tackle in-laws, how to manage our kids. Like everything, the PCOS, either the PCOS will trigger the stress factor, or the stress factor will in turn trigger the PCOS. Both are having an relation also. Like there are so many studies says that the PCOS will, in PCOS ladies there is more nervousness, anxiety, mood swings, eating disorder. When we get stressed, we will order two more burgers or like parotas like that. So and also like the patients will tell, even if I go for dieting, even if I take a half chapati, extra half chapati, the next day I will gain 2 more kilos. That much like variation in weight management also because of the inflammation inside. That is also one thing. So the main thing, we had to concentrate on our stress factors, try to control our diet and lifestyle. That is very important in tackling the PCOS. So we all know the concept of Arthanarishna. There's a concept in Hindu mythology, Arthanarishna, that half Shiva and half Parvati, the balance between male and female, like that. In females also, there is a male hormone, androgens. Androgens are male hormones. So there is some balance between male and female hormone, androgens and estrogens. So in PCOS, there is more secretions of androgens, male hormones. That will cause some presentation, clinical presentation, just like males, like more facial hair growth, like balding, like facial hair fall, more pimples or more acne, more oil secretion in our face are some of the signs which we get clinically as a result of this change in male and female hormone balance. Okay. So usually, like, shall I ask you one question? How many of you are suffering from acne? Can you raise your hands or just put a me in chat box? Can we make this session more interactive? Just type me. Okay, Pooja. Okay, Parvati. Do you feel? Yes, yes. Especially on chins. Okay. So, especially on jeans, like we are having more oily nature in our, especially because of this hyperandrogenism. And when we take more oily food, no, and we when we wash our mouth and all, the oily nature will be around our skin and all. So that will again trigger more pimples, especially around the period. So try to reduce excess oily food in your diet, and also wash when you wash the mouth, no, just clean, like make sure there is no oily or food remnants touching your chin and all. Then you will notice some change. Okay. And like nowadays, study says that if we are have more PCOS pattern, that I will tell what is PCOS pattern, then there will be more acne in our face and all. Both are related. And we all notice like we all are having tiny hairs in our face, very, very small, tiny hairs. That's normal to all ladies. So when there is hormone change, these tiny hairs will start to change and become more thick black color hair, just like males. So that is known as hirsutism, which is more common. Like this is the small, like very tiny hairs which is present in all of our body. So when this hormone change occurs, no, this hormone will come and act at the root of this hair, and it will make the hair become more thick, dark, and strong. So that is how we develop more hair, especially in our chin area, around the breast area, abdomen, back, and all. This is one of the main thing which haunted us ladies. The pigmentation, the facial hair growth, the acne, all these things really matters us. What I personally feel is more than the menstrual irregularities. So when we switch on to healthier diets or when we take medications which correct our hormone balance, no, we had to thread or remove the hair from the roots. So when new hairs are developed, that will be become more thin. That is how we can manage this. Or even if we do laser without correcting the hormones inside us, again the same thing will happen. So we had to concentrate from inside. Like we had to correct the hormone imbalance. Then we can remove those unwanted hairs. This is also one condition. It's very rare. It's for just for your information. Like because PCOS related facial hair growth will be more common around the chin area, neck area, like that. But this is one condition that is purely genetic condition. That's very, very, very rare. Like every facial hair will become more thick. So this is also we can use to grade our PCOS, how severe PCOS are. Like mild, moderate, severity, depending upon the facial hair growth, we can understand how like chronic our PCOS are. And also pigmentation like over the neck area, which is more commonly noted, like neck area, there is more pigmentation, which becomes gradually becomes dark and the skin will become more thick over the neck. So initially we'll think that yeah, I put a new chain that will cause the friction, cause the neck pigmentation like that. Initially we'll tend to take it lightly, but this is also a sign or which may be an early sign also. Even if our cycles are regular, but we can notice some of the pigmentation over our neck. That is also one common thing which we can notice. And type in the chat box if anyone is having this pigmentation over the neck, more pigmentation over the underarm, under the breast, in between the thighs. Just type me. Yes, yes, that's very okay. So one thing is that when we reduce or cut down sugar, no, if you cut down sugar for at least 40 to 45 days, you can see the reduction in the pigmentation instantly without applying any cream or anything like that. Just cut down sugar and start to do some physical activities or do some 10 minutes walking after every meal. That will increase the insulin the insulin resistance so that your cells will take more glucose. So there will not be that much free glucose, then this pigmentation will be reduced. So, like because of this hormone change, especially the insulin, that is the common which we use commonly. Like when there is more glucose in our blood, our cells had to take the glucose to do its regular activity, but the cells are not taking up the glucose. So again, we will feel that we had not taken food enoughly, like sufficiently. So there is more craving for sugar or glucose. That is why we are having more craving. It's not our fault, it's the hormone changes that we are having this more sugar craving. But we need to understand that it is as a part of this PCOS disease. And like commonly metformin, like sugar medicines are commonly given for this insulin resistance to correct the PCOS. But it is not the only solution, or it is not the permanent solution to tackle our PCOS. So commonly, like every PCOS patient is different. Some patients have regular periods, but when they do an ultrasound scan, sometimes they can see a PCO pattern in the ovary. But the patient will tell, doctor, see my report showing PCOS, but my periods are regular. I get periods in every 28 or 30 days. Then how can I be PCOS, like that patient will ask. So different PCOS, some patients will have more facial hair growth, but they don't have any pigmentation over the neck. Some patients will have more pigmentation over the neck. The periods will be irregular. So it is different and for different patients. Some patients will have less bleeding during periods, even if periods appear in after 3 or 4 months. Some will have more bleeding. So how our PCOS, we had to monitor what all symptoms we are having. Then we can plan it accordingly. Like PCOS is one of the major cause for fertility issues also. Like ovulation is not happening proper. Usually you can see like in the ovary, the eggs will develop. The eggs will develop when it reaches to a particular level, like 20 millimeter. It will pop up and ovulate. This is the ovum or the egg which is pop up during the ovulation. It combines with the sperms, get implanted and get pregnant. So if ovulation is or ovum is not releasing, then pregnancy is not possible, no? So the main intention is to correct our periods, then automatically the ovulation will get corrected. So, and also we can see like 30 to 70% of PCOS subjects are obese only. So it is much more easier than managing lean PCOS. When we reduce at least like 5 to 7 kilos of weight, automatically periods will come back to normal. So weight loss is also one important thing in managing or tackling PCOS. So if we are having a doubt, my periods is somewhat irregular, I'm having facial hair growth, or I'm having pigmentation of neck, what to do next? What all investigation should I do? So you had to do some basic investigation, like we can do an ultrasound scan or do some basic hormone tests like FSH, LH. That is commonly there is some balance between these two hormones which help in like for the egg growth, ovulation and all. If the balance is lost, only the egg growth will be slow and it won't be ovulated also. And some vitamin D deficiency. Anyone is having vitamin D deficiency in our group? Chat me. Yes, Devika. Yeah. Yes. Marani. Yeah. It is now common to have this vitamin D deficiency. Yes, most of the ladies are having vitamin D deficiency because we tend to go less in sunlight to maintain our skin properly. And also nowadays, after COVID and all, vitamin D deficiencies are high. We suffer from severe hair fall, like mood swings, back pain, joint pain. All are some of the presentations of vitamin D. But the thing is that vitamin D deficiency will again trigger PCOS, will trigger the development of fibroid and all. So we had to maintain adequate level of vitamin D, take vitamin D supplementation, spend 10 to 15 minutes early in the morning or evening time in sunlight also. So vitamin D is very important. And AMH. AMH is one test which will support or which will give an idea about reserve. So in PCOS patient, usually the AMH value should be between 2 to 4. But in AMH patients, like there are so many eggs, ungrown eggs or unruptured eggs are there in the ovary that will again secrete more AMH. So the AMH value will be 6, 8, 11, 12 like that in such patients. So basically, we can do an ultrasound scan. So ultrasound scan, we can do it in two ways. One is transabdominal. So the doctor will put the probe in the abdomen and will see the follicles growing. But for accurately transvaginal, that is through the inside probe, will give a clear idea about the ovarian growth. So when we do follicular study or we want to understand the like the ovarian size. Usually the ovaries will be like this much, 2 to 3 centimeter. When PCOS become the ovarian volume will be more, it will be more bulkier. The ovarian volume will increase as PCOS progresses. So this transvaginal scan will give a clear idea about the ovarian, like whether the number of follicles are left behind or the ovarian size. So this is a comparison between two scans. Like this is normally an ovary, one follicles is growing like that. So this is the polycystic ovary. You can compare the size also. The ovary becomes somewhat more big. And there are so many tiny follicles. Actually, these are good follicles, but without any proper hormone support, the follicles are still remaining dormant. So these are follicles which also prevent the ovulation or further growth of remaining follicles. So what all side effects can, whether the PCOS cause only an ovulation or infertility issues like that, or is there any long-term consequences as a result of PCOS? As we know, it is a metabolic disorder. It can lead as even after menopause, we can have some of the side effects regarding the PCOS because of the PCOS, like hypertension, type 2 diabetes, like atherosclerosis, as well as endometrial hyperplasia also. It's a long-term sequence, but we can manage or tackle the PCOS. And I had seen patients whose the PCO pattern completely removed from the or completely disappeared during the follow-up scan also. Reversible, but we had to put effort from our side also. So one is the weight loss, the diet, the stress management is having a key role, very important role. We usually give concentration to importance to our weight loss, diet, exercise only, but stress management is also plays a very important role. That's how yoga, meditation plays a major role in managing PCOS. So we had to switch on to healthier food, healthier lifestyle, but it doesn't mean to starve, to avoid, cut down every little treats and all. So, and again, self-care, skincare is also very important, which will improve more confidence for us. So we will give more importance. So our body also need to be taken care of. We usually ladies will give more importance to our family, to kids, everything else except us. So we keep our thing as our last priority. Our health is also important, no? So self-care, our health is everything is important. Just spend some time for us, just 15 to 20 minutes. So our self-care. And also try to monitor your daily activities, like how many times we are spending in social media, how many times we are spending to do exercise, what I eat in a day. Just note everything down, and what all things we are doing, we will get an idea, and what all things to be changed, that we will get an idea. So our main goal to tackle the PCOS is to reduce the stress, weight management, then to correct the ovulation, the diet, lifestyle modification. So as we all know, the PCOS is a hormone, like a hormone change endocrine disorder, but with proper diagnosis, with proper support, we can reverse the PCOS. We had to incorporate diet, lifestyle modification, stress management, and that will definitely support us to tackle the PCOS. Thank you. If any doubt, you can kindly unmute and have an open chat with us. And let us make the session more interactive.
Thank you, Doctor. It was a wonderful session.
Thank you. Bhavani Reddy, do you have any doubt? You can also discuss your concern.
Doctor, there is one question. Treatment for correct ovulation.
Mm. How much time I should spend if the vitamin D level is much low, less than 10, you need to take supplementation at least 60,000 unit once in a week for 8 weeks. That is very important. And to maintain that level, you had to spend at least 10 to 15 minutes in the morning or evening time at sunlight. Normal range of AMH is usually 2 to 4. Treatment for correct ovulation. Yeah, there is treatment for ovulation to correct the PCOS. Mainly in Ayurveda, we don't give medicines to induce ovulation. We just correct the hormones like by itself. Then automatically ovulation will happen. There is no medicine or no hormone pills to correct, induce ovulation in Ayurveda. And it is not a long-term process also. Lean PCOS usually have more androgens than like the diet also you need to concentrate more on to reduce spicy food in your diet. That's very important to reduce spicy food in your diet and also more oily thing in your diet, especially spicy food, because you may have more acne than obese PCOS. Is that right? What's the normal range of AMH? No, we can usually the AMH we will check on day 2 or day 3 of your periods. It's an indicator that like how well your ovary is functioning at that point of time. But like in some cases of any inflammation in the ovary, like say about endometriosis or any PID, we can get the AMH value as like less than 1 and all. But when the inflammation reduces, the AMH may go back to 2 and all, 3 and all like that. Yes, medicines play a major role. But the first thing is the diet and lifestyle. But medicines are having a wonderful role in managing PCOS. Because there are so many cases I had seen, like the PCOS disappeared completely in the ultrasound scan. Is Sukumaram Kashayam? Yes. Sukumaram Kashayam is having wonderful action. But it depends upon patient to patient. Like, depends upon case. I told you, no, some cases there are more androgen, hyperandrogenism. In some cases, more neck pigment, acanthosis, like that. Depending upon the case, the medicines we can select the medication. Dr. Sneha, actually, this session is for a public. Actually, if you need the personal message for that, you can contact Dr. Minu. She will give my personal number, then we can discuss Dr. Sneha. Yeah, that's also but there is no, to be frank, doctor, we need not induce ovulation. That is different, no? We had to correct that hormone change. we had to correct the insulin resistance, we had to correct the hyperandrogenism, then automatically the ovarian function will come back to normal. There is no need to induce the medicine. If it is get corrected, we can understand the follicles will grow properly, the endometrium will thickness will develop properly. It's 100% sure. I had documented so many cases. Anything else?
Doctor, there is one more question in the chat box.
Yeah, that because there is some fluctuating androgens are there, but you had to remove the facial hair growth, and you can notice that the next hair growth will be much more thinner if you are on a if your cycles are regular and if you are on a proper diet and all, the hair will become more thinner, like in every after every threading, not shaving. Like the root has to be removed. Yes. Continuous ovulation induction is not good. Like when you get cooked food, no, like Zomato, Zomato or Swiggy will deliver you food. So sometimes you feel, yeah, so I will order from Zomato. If Zomato and Swiggy were not there, you will make food, no, like that. Your body is having all the things. So if you are getting hormones from externally, your body will not try to correct that. No? So we had to work on correcting the hormone. Yes. Ayurveda are having so many wonderful medications to correct the PCOD.
Thank you, Doctor. Thank you, Doctor, for the wonderful session and the patient answering to all the queries. So, dear participants, thank you for your patient listening. So, we were discussing about our 7-day interactive program.
Actually, I don't specifically give medications to remove the facial hair growth. There was no, to be frank, there was no medicines typically to remove the hair growth. But we can give some of the kashayas, which is mentioned in Ayurveda, that reduces the hyperandrogenism. Like after every threading and all, the next set, the facial hair become more thin and thin. That I noticed in most of my patients. And the patients too mentioned about that. Yeah, Dr. Meena, please continue.
Okay, thank you, Doctor. So, I hope this entire session is useful for the participants. So, as I addressed in the commencement of the session itself, this session is particularly for the public, that's the women population who is affected with PCOS. So, in this group of participants, we would like to know who all are ready to start your reversal of PCOS with us. So make your face smile and get rid of the PCOS with us by modifying your lifestyle changes. So as I addressed earlier, it will be a 7-day program which will be including primarily concentrating on the lifestyle modification, the diet, the nutrition which is required, the PCOS foods, and also the required yogas which is needed for the managing the PCOS, and also the other strategies. Like each day will be basically concentrated on a particular theme, daily activities, the meditation techniques, exercises, the interactive and the awareness session will also be there. This is also only a brief topic dealt in today's session. A wider description will be there in the upcoming session. So the question and answering sessions all will be there. So I would like to know how many of you are interested in this particular 7-day program. Please comment your answer, or if you are interested, please comment S in the chat box. And you will be constantly monitored. We will be from our team. Okay, we are getting good response like S from Pooja Paul, Hajra, Ashida. And seeing this message, it's very happy and excited that we can able to contribute to the community affected with PCOS and awaiting for much more response from the participants. So this 7-day program will be basically having the program fee of 2,500, and there will be a detailed schedule will be given to you for those who are registering, and also a ebook regarding the entire features of the PCOS, the management, the food, nutrition and all, and also the daily tracker timesheet will also be provided. And it is particularly online sessions will be there, but there will be team monitoring you for the follow-ups and all. So those who are interested can pay your fee in the link provided in the chat box. And any queries regarding this 7-day interactive program, that also will be addressed here. So that also you can put in the chat box. So I will describe the day by day of the 7-day program once again. A certain personal message in the chat box is coming regarding the session of 7-day. So the day 1 will be interactive discussion. That's the awareness session regarding the importance of diet, exercise, and the PCOS, and also the PCOS symptoms that discussed here will be again described in detail, and also the meditation techniques and the question and answering the interaction session will be there. So the second day will be based on another theme, and there will be task and there will be set goals for the daily activities, and there will be interaction. That's a community will be formed, which will be of the people with PCOS, and there will be meditation techniques again will be discussed, and the daily updates of the activities will also be there. And also the third day will be priorly on the nutrition, that the nutrition is really very important part. So the nutrition, the role of nutrition, so to how to prepare an ideal meal, and the PCOS disease, and also the person friendly recipes, and also the power foods will be discussed. So that's really a very important part. So the day 3 will be particularly on that, and day 4 will be task, but it will be on the other theme, and also there will be set goals for the daily activities. This task is particularly for the participants to make them physically and also to mentally active, and there will be interaction in the community, which will be a very active discussions, meditation, daily updates and challenges will be monitored. And also day 5 there will be another task on a based on another theme, and there will be creating self-awareness for this goal tracking, and also there will be interaction, community, meditation, and the daily updates and challenges will be there, which will be based on another area. And day 6 will be priorly on the yoga. That's the poses of yoga which is suited for the PCOS management, and the breathing exercises that for the stress management and all, and also the meditation, and the daily updates and challenges will be monitored by our team. So the day 7, again from the day 1 to day 7, the progress that you have attained, the interactive discussion will be there, the challenges you will face will be discussed, and the milestone you achieved, and also there will be active discussion with the concerned consultant. So this is the 7-day plan, and it will be monitored. You will be monitored by our team. So who all wish to register, please follow the link given in the chat box. also, if there is any queries, you can put your queries in the chat box. So I think there is no queries. So hope all of you have understood the session. And it was very nice to hosting a session with Dr. Divya. Thank you so much, Doctor, for the wonderful session and also the patient answering
Thank
to
you,
all the
Satya.
queries from the participants. Thank you so much, Doctor. And also for
Good night.
good night, Doctor. So looking forward to the upcoming sessions also. Good night. And to the participants, thank you all for joining us here today. And also for the further updates or queries regarding this regard, you can contact MedMap Medical Services. So thank you all once again and good night.